When it comes to people who are marginalized, well, the disabled community makes up the largest group. Around 1 billion people, or 15% of the globe's population, live with some kind of disability. Now, in today's Bloomberg Equality, where we examine the bottom line impact of diversity, our own Scarlet discussed how the community is managing through the pandemic. With Haben Girma, Haben has been the first deaf and blind person to graduate from Harvard Law School. She is now a human rights lawyer focused on disability justice.
Everyone has a different set of skills and challenges, and we need to maximize our skills and abilities. A lot of people with disabilities go through training programs to build up their skills. So, for example, blind individuals will build up Braille skills, literacy, orientation, and mobility. And once you have those skills and you have access to computers and internet, then you can use Zoom independently. Lots of blind people are using Zoom independently. There comes times when people don't have access to training, or organizations don't use accessible video programs. Like they may use a different video program that is not accessible. And that's where the barriers come up.
Got it. Now, I want to learn from you how the restrictions and the regulations that have been put in place by cities and states to slow the spread of COVID are affecting you directly. What kind of workarounds, what have you had to do to manage through the pandemic?
I am so grateful to all the people who are staying home, wearing masks, and choosing to help reduce the spread of the virus. Disabled lives matter. A lot of disabled people have compromised immune systems and are at risk to the virus. So when people choose to work from home, when companies create the option to work from home, it makes a huge difference. So I am grateful to anyone who's helping to encourage people to wear masks and work from home. And also to companies who are choosing to use accessible websites, accessible digital services, using video platforms that are accessible. For example, Zoom is accessible, and blind people can use Zoom independently. For the deaf community, we want to see more organizations using captions. You need to hire someone to provide captions so that deaf individuals can participate in the Zoom call or conference. Some individuals will need sign language interpreters. So you bring a sign language interpreter onto the Zoom call or other video program, whether it's Teams or WebEx, so that the deaf person who relies on sign language can also converse and follow along what's happening on the call.
Thank you. Thank you for breaking that down for us. You mentioned that a lot of people who have disabilities have underlying health needs that can make them more vulnerable to COVID. From what you've observed, are disabled people receiving the same type of medical care or assistance as non-disabled people? Do they have the same opportunities for treatment? Do they have the same access to the vaccine if they wanted it?
There are still a lot of people in the medical field, doctors, other medical professionals, who believe disabled lives are not worth living. I've had so many people tell me, oh, I could never have your life. If I were blind, I'd take my life. And it's awful and terrible to hear that. And when that comes up in the medical field, it's devastating. So we've seen this coming up in the pandemic especially, and disabled people being put last in line to receive medical care, or doctors choosing not to provide medical care because they assume wrongly, based on ableism, that disabled lives are not valuable. Our lives are valuable. Ableism is the widespread assumption that disabled people are inferior. We have talents, we have skills. When organizations do the work of removing ableism, then they can benefit from the talents of over 1 billion disabled people around the world.
And that's when disabled people can thrive. I want to end on a positive note as we look forward. Have there been any developments or societal adjustments as a result of this pandemic that have been positive and should be carried forward once we get to the other side of this pandemic?
a lot of disabled people were asking for the flexibility to be able to work from home. And for a long time, organizations would say, no, it can't be done. Well, now we've seen in the pandemic, it absolutely can be done. And when the pandemic is over, I hope many organizations will continue to offer this flexibility to work from home and attend conferences remotely.